I'm Tom Kress. Thanks for coming today. I just want to tell you how much I appreciate you coming. I know it takes your time. A couple things today is I'm going to go over Medicare. It's a Medicare 101. I'm going to give you the basics, the background about Medicare. I'm also going to talk to you about Medicare Advantage, Medicare RX, and Medicare supplements. And then I'll answer any questions that you have when I get done. So if you can write down your questions, that would be great. If you have a cell phone or you have anything else, communication, I'd appreciate if you turned it off. And that way we'll get through this quicker. If you have questions, let's save them to the end if possible. I started in this business now about 8 years ago because of my mom. And my mom, I looked at her policy and she was on a plan, she's paying about $400 a month. And I thought, that's a lot of money when she's only making $800 from her Social Security. I figured out how to have her stay with her same doctors, same medication, same everything, and save her $400 a month, 50% of her income. And I thought, if I can do this for my mom, I should be able to do this for everybody. And I've been able to do that. So today what I'd like to do is tell you a little bit about Medicare 101. We're going to use this book here. It's called Medicare Complete, our Clarity book by United Healthcare. And we're going to turn to this page right here. Does everybody have that? And I'd love you, this is for you to take with you and keep your notes. There's a couple of compliance things. Whether you know it or not, everything we do is set up by the federal government, and there's an office called CMS, Center for Medicaid Services. And there's three things I'd just like to get out of the way before we start. The first thing is the star rating system. What is that? Okay, the star rating system is how the insurance companies are reimbursed. The bad thing is about 2 years behind. United Healthcare has a 4.5 star on their Medicare Advantage locally and 4 stars on their prescription drugs. That probably will not mean anything to you, but we'll talk about it a little bit later what it means. The second thing is step therapy and drugs. When you start up any plan, because of the Medicare RX plan benefits that started in 2003, there's a thing called the donut hole and reimbursements. And in this plan on Medicare, you're going to have step therapy. So what's that mean? That means if you're taking Lipitor right now and there's a generic, when you switch over to this plan off a company plan or under 65, they're going to ask you to try to save the generic. Why? Because it's going to save the system money. 50% of the drugs that seniors take are never used. I said, that's impossible. But you know, it is true, because what happens, you go in, you go to see a brand new doctor at 65 or change areas. The doctor says, you know what, I got this great new drug for you. 2 days into the drug, you got 90 days places, it gives me headaches. Okay, I'll reassign you another one. There's 88 days of drugs in your medicine cabinet. They give you a prescription to get over an antibiotic. They give you a 30-day supply. Who takes all 30 days? 10 days into it, you feel better, you got a 20-day supply in your medicine cabinet. On and on and on. That money costs the system money. So they're going to ask a way to cut down. The most expensive part of the Medicare Trust Fund budget is prescription drugs. So that's step therapy. If you have questions, I answer for it. The reason that you want an agent in this business is the agent can help you through these issues. And you know what? I have people all the time say, is that your direct number, Tom? Yeah, it's my direct number. Everybody gets it. Now, if I'm not available, I have a wonderful lady that takes calls for me, Linda Grant. True story. Okay. The third thing I want to talk about is language. There are issues in here. If you're unhappy with me, in the booklet that we're going to hand out later on, the Medicare Advantage booklet, how to find out extra help, how if you want a better language or information, you can call a number or we'll get it for you. And also, if you're unhappy and you want to file a complaint, all that information is in the book we're going to hand out later. So what I want to do now is use this right here. Everybody in here, do you have a Medicare card? Who has a Medicare card? Okay. Somebody wasn't compliant on turning off their phone. It's okay. So there's two things. If you have your Medicare card and you're all turning 65 in the next 6 months, 3 months out, Medicare is going to send you the card automatically because you're on a Social Security benefit, okay? And they're going to take the money for Social Security Part A and B out of your Medicare Social Security benefit. If not, you have to apply for Medicare. I will show you how to do that at the end of the meeting. And then if you enroll in Medicare, you'll get this card here. This card costs the average person $104.90 a month for Part B. It started, okay, in the last 5 years, it was 99, 110, 104.90, 104.90, 104.90, and 104.90. The Social Security benefit, there was a law the last day in office of George Bush II that unless the Social Security benefit goes up by 3%, they cannot raise the Part B deduction from your Social Security benefit. Guess what? In the last 4 years, the Social Security benefit has not gone up more than 3%, so that's why it's 104.90. It could go down, it could go up. If you make under a certain amount of money a year, you might get extra help, and the state of California might pay for it, or the state of Texas. If you make more than about $85,000 as an individual, $170,000 as a couple, then you're going to pay more. It's called IRMAA. It's part of the Affordable Care Act, 2,500 pages that raised the costs. It's a tax on people that make more income. And if you're in that area, we'll discuss that. But most people, it's 104.90. What do you get with the 104.90 that was started in 1965? You know, the first job that I had, okay, was in Downey, California, and I made window screens. And I made $1.10 an hour. And why do I remember that? Because they opened the second McDonald's, which is still there on Lakewood Boulevard in Florence. I was so excited, okay, about getting that money, you know, that I had decided I was working 30 hours at $1.10 an hour. That was going to be $33 my paycheck. The hamburgers at McDonald's, 10 cents. Cheeseburgers, 15. Shakes, 19. Drinks, 10 cents. French fries, 15. I was in heaven. I went to get my check from Ted Jackman, and it was $29. It's the first time I paid my deductions. Well, in there, in 1965, they started taking out for Medicare. So you actually have a Medicare trust fund. So when you turn 65, you get to use that. And in this area, in Riverside, San Bernardino County, you get $1,091 a month. What does that give you? It gives you Part A and Part B. Okay, Part A is the hospital. There's a $1,260 deductible. Part B is a 20% copay. The federal government pays 80%, plus you have a one-time a year $147 deductible. What does that mean? Well, I like to tell a story. My wife, I have a son that lives in Henderson, Nevada, and we go the back way through 29 Palms and up through Kelso. Anybody ever been that way? Mm-hmm. Okay, well, my wife doesn't like the up and down bumps, but if I go early enough in the morning, it's not late at night, she likes it. She can sleep through that area. Well, what happens if I'm out at Kelso and I get run off the road by somebody and I'm over on the side and a highway patrol happens to come by and says, Tom, we're going to rush you to the nearest hospital because you have this big cut on your arm. Transportation is part of Medicare. Anybody know what a helicopter or helilift would cost me to the nearest hospital?
Over $20,000.
Between $35,000 and $50,000. On original Medicare, what's your copay? 20%, $10,000. Guess what? When you get in the hospital, they do not put you right in the hospital. They put you in an ambulance. $1,500, copay 20%. Guess what? When you get out of the ambulance, they don't let you walk in. They put you on a durable good, a wheelchair, a gurney. You're going to pay more money. And then when you get in the hospital, they go, oh, Tom, we're going to run all these tests on you. MRIs, PET scan, CAT scan, blood test. Okay, great. No big deal, Tom. We'll do a small operation. You'll be out of here in 3 days. All you need is an anesthesiologist, a doctor, a surgeon, a backup surgeon now, recovery doctor, and nurses. At $20,000 to $50,000 a day, when you leave there, you have a 20% coinsurance plus $1,260 for the hospital and $147 to the doctor on the services. That's what A and B gets you. That's what you have when you get your Medicare card. But with the trust fund given you, you have two choices. You can sign up for what I call the bundle, the hamburger, the French fries, and the drink, and you get A, B, and D all in one plan, the Medicare Advantage plan. We're going to discuss that first. Secondary, you can also sign up for a Medicare supplement. That's a la carte, usually more expensive, right? The salad, the appetizer, the main dish, and the dessert. You can order whatever you want, and you're going to pay a little more for that. So let's start now with a Medicare Advantage plan. AARP, who insures over 90 million people worldwide, okay, in this area has a Medicare Plan 2. It's called a Medicare Advantage Plan. If you look back down here on the left on option number 2, there's the Medicare Advantage Plan is called 3 things. It's called an HMO because it's a health maintenance organization. It's also called a Medicare Advantage because there's things in it that have other things other than just original Medicare, and it's called Medicare Complete because it has Part A, Part B, and Part D all in the same plan. So this is the United Healthcare plan. What's the monthly premium? 0. How can that be? Because you're signing the $1,091 a month, in your Medicare trust fund to United Healthcare, and they're covering all of your costs to do with your medical services. What's the monthly premium? $0. Your maximum out-of-pocket called MOOP in the industry is $3,400. What does that mean? In this area, it really doesn't mean a whole lot because you'd have to have 16 ambulance rides to equal that. It's not a deductible like under 65 insurance. And then everybody has a question about that. But there's no deductible on this plan. Doctor's visit, you have to find somebody in the network. And this network locally is Oasis. Okay, there's over 480 doctors involved. You have to pick a primary physician, HMO network, $0 copay. If you want to go to a specialist, you have to get a referral. Guess what though? The cost is $0. Cardiologist, dermatologist, podiatrist, any of those. With that referral, there's no cost. If you go outside the network, then you're going to have to pay for the doctor out of your own pocket. Here's the thing that I couldn't believe when it started. I used to call it the WOW plan. Okay, besides you get preventive services on page 31 of the booklet, there's about 33, 34 preventive services that you get included in here. Bone density test, pap smears, mammograms, all these different things are included in the test, and you and your doctor can work that out. But the hospital benefit, you get worldwide coverage, $0 copay. Locally, you get Eisenhower, JFK, Desert Regional, High Desert. Okay, and if you're living in Riverside, San Bernardino, you can have Loma Linda. And you can switch between the different provider groups each month at the start of the month, no charge. You actually have a little bit of a PPO built in here at no cost. If you decide you don't like the Eisenhower group and you want to go to Loma Linda, you could do that. You just have to pick a new primary doctor. Unlimited days, I say 365. So the 365 days in these hospitals, for any medically necessary reason, no charge. You're traveling anywhere in the United States and you have to go to a hospital. I had somebody that was in Dallas, Fort Worth about a year ago, had a heart attack, called me and said, Tom, I have a question. I said, what is that? He says, I just spent 10 days in Southern Methodist Hospital, had a heart attack, they put a new stent in. I said, what was the copay? He said, $0. I said, wow. He says, my big question is they told me to have my stent checked in about 30 days and I'm going to Kentucky for a wedding. Do I have to come back? I said, no, just go into urgent care, pay a $50 copay and you'll be great. He goes, good, I'll see you in the wintertime. So you have worldwide coverage on this plan. If you're outside the United States, I've had people in Greece, for example, a lady that was on an ocean liner, had a heart problem. They took her by helicopter, she says that's almost killed her, by helicopter into Athens, Greece. Spent 3 days there, called back to the doctors, got a new medicine, stabilized her, put her back on the ship, $3,400. She brought the bill back, United Healthcare paid all of it. $3,400 worldwide coverage. Wow. That's why I call this the WOW plan. If you're under 65, you couldn't afford to buy this kind of policy almost. The next thing is skilled nursing facility. You get up to 20 days in a skilled nursing facility at no charge. After that, there's a copay. Now you have an alternative. You can have home health care at no charge. If the doctor prescribes you, they'll bring the doctor, the nurses, the apparatus to your house, and they will fix you and take care of you. The longest I've ever had is a person for 120 days on a spleen problem. He came back, it was another 250 days in 1 year, no charge. That's incredible coverage as long as you're getting better. It is not assisted living when you get older to take care of you. This is if you're improving on your condition and the caseworker says you're getting better. The next thing that we're going to talk about is diagnostic services. There's 1,200 diagnostic services. Anybody know how many there are? How many, what's the most expensive diagnostic service? Open MRI. Open MRI locally, $4,000. On original Medicare, 20%, $800 copay. On our plan, if it has a radiological background to it or problem, it's $50 copay. Pretty good deal. Any non-radiological diagnostic test is $5. If you're in the hospital in an accident and the hospital does it, sometimes they waive that charge because it's part of the hospital charges. But if you want to go on a hike next week and you think you're injured your knee in a tennis match, and you go in and ask the doctor to get that test for you and he gives you the prescription to go to the imaging place, then you'll pay a $50 copay. The next thing I want to talk about is lab services, $5. So anytime that you go to the lab for a blood test or whatever the doctor has prescribed, it's $5 copay. Outpatient x-rays, $0. Ambulance rides are $225. That's where it's a helicopter, fixed wing, jet, or ground. Now the most expensive one I've ever heard of, I think Matt was at the meeting, it was at Aspen Mills. The guy had been in the San Juan Islands in Washington, 64 and a half, had a heart attack. He said, we're going to fly to Seattle to operate on you. He said, please let me die. They said, no, we have HIPAA laws. We have to take care of you. $94,000. He's paying $500 a month. You know how long it's going to take to pay off? A long time. Had he been on our plan, $225 copay. Urgent care. Urgent care is $30 locally or $50 nationwide. So you're in New York City, Saturday afternoon, you have this phlegm come up, you're not sure if you've got pneumonia, you don't want to go to the emergency room, you pay $50 copay. Inside the doctor network is $30. And Oasis actually has a few locally that we can hand out that are zero. 7 days a week, you can go into them to urgent care. They can write a prescription, they can refer you to a specialist, they can take a look at you, x-rays, no charge. Have I missed anything? Okay, the next thing we're going to talk about is the prescription drug program started in 2003 under George Bush. Now, this is a compliant issue. Okay, there's going to be a test on this afterwards. And what happened when George Bush passed this law in 2003, can you imagine he wasn't getting along with Congress at that time? He asked him for $100 billion. They gave him $60 billion. So this plan that we're going to talk about, okay, is Congress's plan. It's not the pharmaceuticals, it's not the doctors, it's not the hospitals, it's not anybody else's. Guess what? Congress is not on this plan, just you and I. Okay? So here it is. There's 3 levels to it. There's entry level, the donut hole level, like a hole in a donut, and there's the catastrophic. It's based upon retail dollar amount. Okay? People describe it different ways, but basically, I take one drug, lisinopril. Lisinopril it's a tier 1 drug. There are 5 tiers. There's generic, non-preferred generic, branded, non-preferred branded, and specialty drugs. They all have a different copay. On the generic, which UnitedHealthcare just in the last year upgraded over 320 drugs from tier 2 and tier 3 to generic 1, there's no copay at over 62,000 pharmacies in the network. The pharmacies that aren't covered are some of the compounding pharmacies, but most pharmacies take it. Okay, it has a $25 retail lisinopril. That goes against 2 trigger amounts. There's a trigger amount at $2,960 that launches you from the entry level to the donut hole. And then there's another amount which is $4,700 that launches you from the donut hole to catastrophic. If you're taking Lipitor, which is a tier 3 drug, retails about $250 to $300 depending on where you get it, but the copay would be $45 a month for a 30-day supply. On one branded drug, you'll never hit the donut hole. On 2, you will, about 1 in 15 people. And then if you get to the specialty level or the catastrophic level, the actual cost of the drug is going down. At this point, when you look at that, you go, what is going on here with this plan? Let me just give you an idea of how it works. I have 4 people, okay, of over 2,500 people I enrolled that have hit catastrophic. 3 of them on the same drug, Humira. Rheumatoid arthritis, self-injectable, tier 5, 33% copay, $1,500 a shot. I have one lady that takes a shot a week. First shot, $500. Second shot, $500, but now she's been launched into the donut hole. In the donut hole, she pays 45%, $600 for the 3rd shot. 4th shot, she's now in catastrophic. It goes down to 5% or $45 a shot. She gets $72,000 plus prescription drugs a year for about $3,000 or $4,000. So you're on the high end, you're taken care of. On the low end, in the middle, you're in the donut hole. Okay, there'll be a test right afterwards. So the next part we're going to go to, okay, is why do they call this a Medicare Advantage plan? And at the bottom back of this page right here, the Medicare Advantage plan, okay, these are things that aren't in original Medicare. In this plan, you get a routine physical. In original Medicare, you get one physical in your lifetime called the Hello Medicare Physical. After that, you have to pay for it. And it's very key, if you have somebody on a Medicare supplement, how they word their annual physical so they don't get charged for that. We'll get to that later. You also get a vision and a eye test every year for glaucoma and for Prescription, no charge, and you get a slight discount on eyeglasses. And we can talk about where you can get those. Hearing, fabulous. Anybody that's on a hearing problem and has had to buy hearing aids, I have more people probably switch for one item during open enrollment because they hear about this. You get a $5,000 hearing aid for between $280 and $300. It's a mail order system. You get the prescription, you order it online, it comes to you, you can get it fitted, and there's no charge for the fitting, no charge for the appointment for either through an eye, ear, nose, throat specialist, what I recommend, or you can go to an audiologist that High Innovations recommends. Either way, there's no charge for that prescription or for that test. And you save a huge amount of money on hearing aids. The only thing better, if you're a VA. VA is zero charge for the hearing aid, and they include the batteries. The next thing you get is transportation. This is a big thing for a lot of people, especially as you get older. They'll drive you to and from the doctor's office up to 60 miles round trip. I just signed up a person at Mountain Center. Can't drive anymore, he's got really bad eyes, and they'll come and pick him up. He was thrilled about this. They'll take him down to his doctor, Dr. Caruso on Highway 111, and he can see the doctor 12 times a year at no charge, and he can take another person with him up to 18 years or older. So that's transportation for an older person is fantastic. You're going to get a dilated eye test. You're going to get a, what's the deal where they check your colonoscopy. You can do those things because you don't want to drive, they'll take care of you. The last two things that you get here are on the next page is you get a Silver Sneakers. Fabulous program, okay? You get over 10,000, actually I saw it yesterday, 12,000 locations nationwide, locally World Gym, 24-hour fitness, and Curves for ladies. And then you get a 24-hour nurse hotline. You can call 24 hours a day, 7 days a week, in your language. You get a nurse, talk to them about what your problems are, and they can answer you, tell you whether or not you should go to the doctor. In fact, we used it about 2 years ago with Diane down in Imperial Beach, and she was feeling really bad, and the nurse walked her through the situation, and it turned out terrific. She just waited one extra day and got better. So that's the Medicare Advantage Plan, United Healthcare. There is one other thing called the Plan B penalty. If you don't enroll in Medicare Part B, Part D actually, if you don't, there's two parts here. On the Part D plan, some people say, I don't want the drug plan, and I just want to be without it. And the Part D drug plan is if you don't enroll into it when you turn 65, there's a penalty for every month that you miss for the rest of your life until you do enroll in it. So my example is I had a doctor 2 years ago that called me up, 75. I didn't know his age, I didn't know what he did. He said, Tom, my next door neighbor lives in Palm Desert down there. He said, you knew a little bit about Medicare, I want to get a Part D. I said, okay, what do you do for a living? I'm retired. I said, great. I said, what drug plan have you had before this? I've had none. I said, how'd you get your prescription drugs? He said, well, I got them from the other doctors. I said, well, why wouldn't you keep doing that? He said, they've all died. I said, okay. I said, you know, that's been 10 years you could have had the plan. 1% a month. Basically, you're going to pay about 32 cents a month times 120 months. It's about $45 a month penalty for the rest of your life to enroll in a plan. If you wait longer, it goes up. He goes, okay, I got to do it. And he enrolled in the plan and bought a standalone prescription drug plan. Also, on Part B, there are penalties depending upon when you late enrollment, don't enroll when you could have, you think you have credible coverage. Those are all unique issues that we can discuss with you on your individual basis. Any questions about Medicare Advantage plan? What's the question?
What are my enrollment times?
Your enrollment times. If you look on the back of this page and the handout, you can enroll 3 months before, the month of, and 3 months after at 65. And you also have annual enrollment. In the first year on a Medicare Advantage plan, if you don't like it in the first year at any time, you can switch back to original Medicare and enroll in a supplement. There may be underwriting issues. Usually with UnitedHealthcare, there's no problem. With other companies, there can be a problem. But if you decide after 6 months that I want to go to a doctor who's not in the network and you want to switch, you can disenroll, and it's called a trial program, special election period. But you have 3 months before, the month of, and 3 months after when you're 65, and annual enrollment, which is October 15th to December 7th right now. Did that answer your question?
SCPs?
SCPs, special election periods. There's 26 of them.
Wow.
So if you want to move, you're covered. There's many things that you can do. Also, many people come off group plans. I know that 2 of you here are that today, and you can enroll the next month after you come off the group plan, so you're seamlessly into the plan, even if you've been on it and you're 70. What we're going to do now is discuss option number 1. This is the a la carte. The reason that people take this plan, okay, is one thing. About 90%. They want to go to a doctor who's not in the plan, and they want to do it without referrals. You can go to any doctor that takes Medicare in the country without a referral in this plan. It's 65 on a plan N. It costs you about $107 a month here locally. And then you also have to have a standalone prescription drug plan with it. 99.9% of all the people in prescription drug plans I enroll in standalone are either United Healthcare or Humana. Humana has a great plan at $15.70 a month, but you can only go to Walmart. They have a really good plan if you do mail order. If you want to go to a lot of pharmacies, you don't want to switch pharmacies, then United Healthcare has a plan at $28 a month. Terrific plan, go anywhere, same benefits, you're traveling, you get stuff sent to you, it's a great plan. And then on the Medicare supplement, there are really 2 plans, the Bentley and the Lexus. There are A, B, C, D, F, K, L, and N, that most of the ones, but 99% of the people I enroll are F and N. F, it used to be the #1 plan, the Bentley. If we turn to page A inside the Medicare supplement, and you're looking at the Medicare, which you don't have in front of you at the moment, but we'll hand out, the A part covers the same as we talked about, all the hospital. Anything that takes place in the hospital, you can go to any hospital in the country for any medically necessary reason, up to 365 days on the F plan, the cost is 0. On the Part B services, on the F plan, the Bentley, any doctor without referral, you want to go straight to cardiologist, dermatologist, any clinical procedure, any chemotherapy, radiation, durable good, blood test, ambulance, transportation, all are 0 copay, urgent care, emergency room. On the N plan, it's 40% less. A is identical to the F, but 40% less means there must be something that's different. On the Part B, you have a $147 deductible. You pay up to $20 doctor copay for only the doctor's visits in a doctor's office, and you also have a $50 emergency room visit fee if you're not admitted. If you're admitted either on the Medicare Advantage or Medicare Supplement and stay over 24 hours in the hospital, those are waived. There's one other thing called excess charges. Never had it happen, but I understand in Tucson there's some doctors that do it, and that is if you go to the doctor's office, okay, or go to the hospital, and they tell you in advance, the doctor's office, and they tell you in advance, we're going to charge you more than the approved Medicare rate, and you sign the contract, they can charge you up to 15% more. Actually, they can charge you any amount, but on the F plan, they will cover 15%. On the N plan, it doesn't cover it. Any questions? Thanks for coming today. Open up your books, start filling out the form. We'll be around to collect them and sign them for you. Thanks, and have a great day.